All right.
Morning. Thank you guys for coming out today for our October Walk with the Doc. We have with us Dr. Gath and Rylee. They're going to be talking to us today about some resources for opioid overdoses. We have some of our Narcan kits here too. We just really appreciate you guys coming out here and hope you all enjoy the walk and the talk.
Hi everyone. Again, it's nice to see you and meet some of you. It's not just opioid addiction, but addiction in general that I really wanted to talk about. So I'm going to ask you all who are so smart. I thought there's going to be more folks from the community, but what is addiction? What is addiction? What does it mean? No one?
That's a complicated question.
All right, just answer it as simply as possible.
Part of it is a mindset. There's also physiological changes that also happen with it.
Yeah. So there's physical and physiologic changes, but what, at its core, addiction is doing something, whether it's ingesting something, mainlining something, swallowing something, or an activity over and over and over again that you know is not good for you, but you like it and you keep doing it, and you can't really stop without having problems stopping. So that's addiction. So addiction, yes, opioids, clearly. Other drugs, right? There's cocaine and meth and all that. And then there's alcohol. It's a big one in the state as well. We should not ignore it. Smoking, an addiction. I can personally tell you that, I'm a few years older than you guys. And in my day, if you wanted to be a women's liver, you had to smoke a cigarette. So of course I did. And I remember starting to smoke and thinking, oh, it's fine. I'll have one or two when I go out, and that would be it. And then all of a sudden I realized, oh, you really do need, maybe I'll buy a pack, just one pack. And then I think by the third pack I said, oh, it's got me. And I thought, well, at that time we didn't know it was dangerous. So I said, all right, so I have this habit. It's not hurting anyone, it's not hurting me. I didn't think so at the time. But it took me 17 years to figure out, and that by then the Surgeon General had come out and said how dangerous it was, and there was also a lot of research into the dangers of cigarette smoking. And it took a long time. It was hard to quit, not easy. You go through withdrawal from cigarette smoking as well. Talk about personal experiences. I have a nephew who is addicted to heroin. And it's so heartbreaking for the family, for his mother, he lost his job, he lost his housing, it's, how many times can you go into rehab? It's very, very hard. So it is problematic in the society. Other forms of addiction we don't think of as often, but clearly are problematic, are certain activities, such as, anyone? Eating, yeah, overeating. I had a patient who was quite large, and she had diabetes, not surprising, and her diet was Reese's peanut butter cups. She could not give those up, and she died ultimately. But it was very sad. I eat hardly anything, yeah, right, but 2 bags of Reese's peanut butter cups. So that's an addiction. Any other types of addiction, activity-wise? Gambling, big one, right? So you win at the casino and you think, it's great, I'm gonna do it again. And then you lose something, oh, I better do it again because I gotta make up for what I lost. And then you might win a little bit, and so it becomes this habitual thing. So it may be pleasurable to start, but then becomes a point where you cannot stop it without intervention. Internet. How about internet? Yeah, a gaming internet where you're on the computer for hours and hours. Now, look, we live on a computer. I get it, but I'm talking about not work related. I'm talking about doing something that's pleasurable, like gaming or I guess social media, that sort of stuff, which can be dangerous after a while. It's fine to do it a little bit, right? But if you cannot stop it, it's a problem. Sex. All right, so yeah, wonderful. Sex is great, not a problem, but there are folks who have an addiction to sex and sexting, right? So that's where the problem is. All right, where was I going to go with this? I said pretty much that. So the enjoyment, which is initial, creates this powerful urge to do and redo and redo. And some of it is because the more you do it, the more you have to take or do it to get the same effect. So that's part of the addiction cycle. And the other cycle is if you do try to stop it, there are consequences for you physiologically and physically. So I already talked about how it can adversely affect your personal life, your professional life, your career. Pay attention when people tell you that you have a problem, because you probably do. Let's see. Oh, and then I didn't even talk about the physical or psychological effects of addiction, right? So especially substance use, where you can develop endocarditis from IV drug use, or HIV, or what other things? I mean, certainly cirrhosis and strokes and blah, blah, blah. You guys know all that. It's very problematic physically, and then psychologically, it's depression, anxiety. A lot of folks are diagnosed with bipolar, but really I think it's substance abuse and then trying to get it up and down, but whatever. There are a lot of psychiatric and psychological issues. Also losing your family, losing your profession, losing pretty much everything that you had. Okay. So I didn't mean to be down. I think that all addictions can have a cure. All right? Everything can have a cure, but you have to want it. That's number one. And Rylee's going to take it from here. I mean, both in terms of what some of the side effects of addiction withdrawal are, so that you recognize it, but then some of the resources that we have.
Thanks, Dr. Gath, and also thank you for sharing like your personal side of it. I know that statistically, and also just like from my personal life, especially people in the South, people in Arkansas, people in Little Rock specifically, like the stats would say that you either have an addiction yourself or know somebody that is close to you that has one, or you know, it's around us all the time. So anyway, I'm Rylee Cook. I'm a third-year med student, and like Dr. Gath was saying, the two big circles that we talk about with addiction are tolerance and withdrawal. And tolerance is what she was explaining, where you kind of need more of whatever it is to kind of get the same effect. So maybe it's, you know, drinking more to get the same drunk, or whatever. And then the other thing is withdrawal, and those are kind of the symptoms that start keying people into the fact that they probably have a problem, because it's like the cycle will keep going, and then eventually you're like, okay, maybe I want to stop, and then you start noticing that you are having trouble functioning without it. So that may be anxiety, or maybe depression, or notice that your heart is racing, or you know, just your body is just feeling like you can't function without it, and you start craving it. And we hear this a lot with people being like, oh, I need a smoke break. I need a smoke break every hour, every 2 hours. I gotta go smoke a cigarette. And that's kind of like the number one example around us literally all the time. Even in the hospital, patients are always like, I gotta go smoke somewhere. Yeah, and so I kind of wanted to talk about a little bit of what Dr. Gath hinted on, of like listening to the people around you whenever they say, hey, you might be doing this too much, or maybe you have a problem, or you know, the people who are around you kind of know you the best. And so if people at your job or people in your circle start noticing that maybe you're agitated, or you're having changes in eating habits, or you're complaining about your sleep and they're noticing that you're using whatever substance or doing whatever action that's hurting you, it's important to listen to those people. And I think that's that's kind of the part that we talk about a lot. So I also brought in a bunch of resources that are around us, because like Dr. Gath said, like they're, especially in Arkansas, since it's such a big problem, places like UAMS in the state in general have done a really good job of providing things that you can do to kind of seek this cure, or to at least like try to get help. And in Arkansas, I was wanting to note, because I think the number one thing whenever I talk to patients about this is they don't have insurance, or they don't know how they're going to pay for it. And Arkansas has a lot of resources that are completely free. Like, it doesn't matter if you have insurance, it doesn't matter if you even have a residence here, that they provide counseling, whether that's group counseling or self-counseling, or entry to different programs or rehabs. They offer like medicinal treatment. There's different things that they can do to kind of ease the withdrawal symptoms, or hush the cravings. So yeah, I had a bunch of those written down, but I thought it was important to note that in Arkansas, like we do have access to those things. It's not just something that's for people who are part of UAMS or work here or have insurance or whatever. So also on these papers that we have, there's several 24/7 hotlines, and then also I wrote down several of the UAMS resources. So the Psych Research Institute has basically an addiction clinic, and they have one that's for adults, and they also have one that's aimed at like older kids and teenagers. And that adolescent age is like a very specific. Yes, the 6 to 21. So the Six Bridges Clinic is, I wrote this down because I knew I would need to ask. It's 12 to 21. But yeah, so they have a very like specific way of maneuvering the addiction, because likely someone who's 12 years old didn't just randomly pick it up. A lot of that is going to be their surroundings and things that are maybe out of their hands, and so they have the resources to remove you from whatever environment maybe have started that. So I think that's really important to talk about too. But we have all those. The Addiction Clinic and Miss Peggy Healy actually sponsored several naloxone kits. So we have those to give out. And naloxone is the opioid reversal. I know that we talk about it a lot, and sometimes I see in hallways and stuff that we have them in, like, we have little naloxone, or it says opioid overdose kits, and they're everywhere, like kind of by the AEDs in the hospital. And I think that's a really great resource, but also just focusing on how it's not only opioids that are, causing a lot of these problems. It's a lot of actions and a lot of other things. They say the number one addiction is actually caffeine, so I think all of us are probably guilty of that. So yeah, that's really all I have.
Yeah. Are there any questions or comments or?
What were the names of those clinics that you had?
Yeah, so we have some 24/7 hotlines. There's 4 of them that I had listed. The easiest one to get a hold of, so the National Suicide and Crisis Prevention line, so it's just 988, the same way that you would call 911. So they say that one's kind of the easiest one to remember, but we also have several listed in Arkansas. But then for just at UAMS, we have the UAMS Center for Addiction Services and Treatment. So that's what I was talking about, where Miss Peggy Healy is, and it's over in the Psych Research Institute on the 4th floor. And then we have the Six Bridges Clinic, and that's the adolescent clinic, or it's from 12 to 21. And then also DHS Mental Health and Addiction. So they, in Arkansas, they have a website, and they have like a master list of all of the different rehabs and stuff, because our state's really good about having a lot of different inpatient, outpatient, even just if you need somebody to give you a phone call and make sure that you're on track and you don't have the time or the whatever, to be able to go do it. Because a lot of people, like, they'll come in and they say, I have kids, I can't leave my house, who's going to raise my kids? And really, they're not the first person to have that problem, right? And so we have a lot of resources that can kind of meet you where you're at.
Yeah, resources, there are a lot, but not always easy to access. So you have to be persistent, and you have to want it. Because if you, the person with the addiction, does not want to get rid of it, oh, well, I could do only a little bit, it's probably not going to get into a program, which can be problematic because, you know, people who drink excessively but would like to have a drink once in a while and can do so with moderation might be able to do do so with some counseling and maybe medication. All right, so there's Wellbutrin, there's Camprol, I can't remember the generic, and there are a couple of other medications. I mean, what is it? The one that you vomit. That's all right. There are a couple.
Naltrexone, right?
Well, naltrexone can help.
Oh, that's the cravings. Okay, never mind.
Can help the craving. So I think that there are a few but you have to ask your doctor because that may not show up on the questionnaire, or we're not always so honest when we fill out the questionnaire. Okay, so I think that the honesty with the addiction has to be very personal, and you have to want it, and there is help. That's important. But shall we walk?
I think so.
Absolutely.
Thank you all very much for coming out. We really appreciate being here, and we hope to see everybody out here next time.
Good. Who wants an naloxone kit? You want one? A family, a friend, or someone? No one? Your church? Your...
I can take it to the church.